Welcome to HealthCast, the heartbeat of health IT. I'm Alexander Bolova, production lead at GovCIO Media and Research. With me today is Editor-in-Chief, Amy Kluber. Hi, Amy.
Hello, Alex.
So you had the opportunity to chat with Ian Komorowski, Executive Director of Strategic Investment Management at VHA. I guess my first question for you is, what does strategic investment management mean?
That's a great question. And that's something that he basically dives into very well during his conversation. Because when you think about such a big organization, health IT is like such a critical component of their operations. When you think of things like 3D printing, the electronic health record, all this notable tech that impacts the healthcare landscape, you need to have kind of that office that is facilitating funding for those things. So that's basically what his office does. He prioritizes like what needs to be funded, how to get health IT in the door, and not just like a cool thing to have, but actually something that is able to be used and operationalized.
Yeah, that's really interesting to have that perspective. We don't often get that. In addition to Ian talking about his role, what were some other topics of conversation? What came up?
I think one of the interesting things that he brought to the forefront was how legislation impacts a lot of his decisions and the office overall. So he mentioned something like a lot of legislation doesn't actually come with funding. They kind of have to figure out how they're going to meet that legislation or whatever. But a couple of things do come with funding. So he mentioned like the CARES Act, the American Rescue Plan. So it's kind of like interesting to hear that balance of legislation and how it impacts an agency. And then another thing I thought was interesting, which I'll let him speak to this, but VA just announced a notable accomplishment around homelessness and veterans. And I'll let him provide the exact stats and everything. But something that really stood out to me was when he said, if you get a veteran into a home, that's the starting point for their healthcare. So I thought that was pretty impactful because, a lot of the times people are like, well, what does that have to do with health IT? What does that have to do with tech, et cetera? But at VA, the mission really reigns true a lot of the times. And if you get a veteran into a home, you're getting them started into that tech journey that is so critical for such a big organization like VA.
Wow, it really sounds like Ian was the perfect person to have this conversation with.
This was also his first podcast ever. And that's really surprising to me because you'll hear like it was such a good conversation. And I'm honored to have been his first podcast. So,
Well, let's not keep our listeners waiting. Let's check out your conversation with Ian.
all right. So you're executive director for VHA's Strategic Investment Management Office, and you're somewhat newish to the office, if I understand, and it has some oversight over health IT investments. So can you tell me a little bit more about the office and what does that mean and how is it benefiting the veteran?
Great question. So yes, I've been the executive director of Strategic Investment Management, or SIM, for about a year and a half. And we are actually part of the Veterans Health Administration and in the Office of Health Informatics. So we are really on the business side of IT. And to a large extent, what we try to do is coordinate the breadth and enterprise view of VHA's IT needs. We do that through actually three services that we provide: business architecture, requirements development management, and investment governance service. And in our business architecture space, the most tangible component that we do is business process modeling. We do that at the field level at facilities, but also for our national program offices. We often use that to elicit business requirements that our RDM service manages. And those business requirements are developed in a solution neutral terminology to help scope the need that a program office needs. And then we work with our partners in the Office of Information Technology to get cost estimates for those so that we can then turn those into a request that gets prioritized by our investment governance service. We try to look at all of VHA's health IT needs comprehensively. So we do a multi-year program. This year, we're actually in the midst of our FY 25 to 29 MYP and look forward, so we're really forward looking on that. And then again, partner with OIT to bring that into OIT's overall budget and represent, VHA's strategic priorities in a way that everybody can understand, and we can move forward for funding through the congressional budget cycle.
Such an critical role when we're talking funding, especially for such a big organization like VA and VHA with that. So when we're talking about health IT, components of that can get pretty complex. I mean, you mentioned it yourself, you're talking business architecture, requirements, governance, and there's so many stakeholders at play. So how do you balance all this?
That's a great question. And, fundamentally, the bringing it all together and reviewing everything in a full package allows us to create that balance. We have a lot of legislative drivers that come in, and often when a new piece of legislation triggers a need for health information technology, we have to review that in context with all of our other needs, sustaining our existing systems, delivering on our core mission of healthcare, medical education research, and other components of VHA. And having that comprehensive view and managing that year over year, SIM has existed for about 10 years now, allows us to look at new things in context with the rest of the enterprise and the historical needs. When we do the prioritization, it's not just my office. We actually facilitate the process. We are a formal part of VHA governance. We have an IT committee that's co-chaired by a central office member and a network director from the field, and then have a number of capability management boards below that again, are co-chaired by central office and field staff with membership that looks at the needs and helps weigh them and their relative priority against every other need that we have.
And you did mention legislation there, which I do want to pull on that more because there's so much that we've learned or heard about recently just in the news alone with the CARES Act, the PACT Act, the Compact, so many priorities in play at the same time. How do you balance that and make sure the resources are properly allocated?
Yeah, that's a good question. So with these large, complex sets of legislation, most of them do not actually come with funding, right? So what happens is that we analyze them and see if maybe some projects that are existing might support that piece of legislation. And if not, then again, we go through our process, we create requirements, and depending on the congressional deadline, may insert them as an unfunded requirement and try again, compare that to the existing work. And try to get those going within the timelines that are in the legislation. Other pieces of legislation do come with funding. And, I'll talk a little bit about, in particular, some slightly older legislation, the CARES Act and the American Rescue Plan, where they were really focused on providing funding to help with our pandemic response with the COVID-19 pandemic. In the VHA space, one of the things that was critically important to us is, not only having our office staff and administrative staff shift to telework and needing to support that, but having to really shift our model of healthcare. Historically, we do provide both in-person and telehealth, but our telehealth care provision grew by about 1,000% during the pandemic. And we needed to sustain that from a technology perspective. So particularly the CARES Act and then the American Rescue Plan, we were able to allocate that funding to support health IT programs that were expanded during the pandemic. And telehealth is just one of many examples. What it's also done, though, because it's also special purpose funding, is that we were able to partner with the Office of Information Technology and tag that funding to projects or partial projects. And it's really actually improved transparency. OIT has been able to build dashboards for us so that we can track what projects are being supported by the American Rescue Plan, the CARES Act, and now the PACT Act, which is a little different, but still really critical to our healthcare provision. And that transparency allows us to ensure that the money is being spent efficiently, that the projects are delivering, and give us advance awareness that if we do need to shift that funding around, we can reallocate it and ensure that it's being spent appropriately.
We're going to take a break from today's interview and play a game I call Archive Deep Dive, where I challenge our hosts to identify a previous guest on our podcast. Playing today are Editor-in-Chief Amy Kluber and Staff Writer-Researcher Catherine McPhail. Hi, everyone.
Hello.
Hi, Alex.
Here are the rules. I will play the clip, and if you know the answer, buzz in using a buzzword. Today's buzzword is modernization.
Oh boy.
If you get it wrong, the other player gets a chance to guess. If neither of you get the answer, I open the floor to random guessing until somebody gets it right or I give up and tell you. There are 3 clips today. Are you ready?
Yep. So ready.
All right. Here is your first clip.
That it's really being market driven. It's not the government that necessarily is mandating this.
Modernization.
It's private industry. That's
am I allowed to do
really,
that?
Yeah, you can.
moving in this direction.
It's Thomas Santucci, who is the DCOI director at the GSA.
Very good. That is Thomas Santucci right off the bat. All right. Clip number 2.
My time coming into AID coincided with the rise of mobile phones and the big mobile revolution, and really saw that as the big game changer. It was right around the time where feature phones were starting to pick up steam in developing countries around the world. The first smartphones were coming online in our own lives, and we were starting to acknowledge the opportunities in front of us.
Modernization.
Yes.
It's Chris Burns, who works for USAID. Give me a second on the title. I can do this. He's working on digital, director of digital. He's the director of digital.
He's like the chief AI office, or not AI, chief digital
strategy
something officer.
Yeah, chief. First ever digital strategy officer, chief of digital strategy. It's something like that. It's kind of unusual.
One of the chiefs.
Yes, you're awfully close. It's Chief Digital Development Officer.
Development.
That's right. You got that one right off the bat as well.
See, this is very unfair because I did do both of those interviews. So I'm at an advantage.
I was wondering why you got those pretty fast.
Yeah.
Well, Amy may be at an advantage for this one because a little hint is that this one's from all the way back in 2020.
Oh, man.
But I think that the IT priorities and challenges are basically the same across federal and DoD organizations. We all tend to focus on providing reliable technology, processes, and resources to meet the mission of the organization, while balancing IT management requirements for and operational readiness.
Modernization?
Yes.
Gosh, I can picture that episode. Was it TikTok, TikTok, TikTok? It wasn't Wanda Jones Heath, right?
It was not, no.
Let me do some searching.
Amy, no.
Gosh. Well, she's obviously a DoD.
Is she?
Oh, man.
Should we ask for a hint?
I know. We need a hint.
FEMA.
FEMA 2020.
Oh, Latweeva Hutchinson.
That is correct. It is Latweeva Hutchinson. Very good. That's right. This was one of the earlier episodes that I edited, and it was really interesting listening back those first couple of months when I was here. It was all pandemic coverage. It's So interesting to see this snapshot of where we were then.
That is true.
A really good
She
archive.
was a very good interview. I believe she has left government since then.
Well, she lives on not only in our podcast, but in Archive Deep Dive. Catherine, you have won today's round, but Amy, there's always next time where you can get your revenge.
Oh.
Well, thank you all for playing, and with that, let's go back to the episode.
Again, because of the financial situation at play, it's such an important role, it sounds like, and can get kind of complicated. So when it comes to like things like emerging technologies, you mentioned telehealth, which, you know, we saw boom over the past couple years, just not even just in government, but across the entire industry. So with other emerging tech and, you know, associated investments with those, how does the changing tech landscape impact how you kind of approach some of those business decisions?
Yeah, it is complex and fast moving. You know, in the case of telehealth, VA has been a leader for many years. And so it was more of a growth of a technology that already exists, and we were well positioned for it. But with artificial intelligence, machine learning, you know, the intersection of IT and healthcare, there's always new things happening. And so my office tries to really help plan to scale things to the enterprise and that long-term plan. We actually partner with many of our innovators within VA. Within VHA, there's a health innovation organization. And again, they look at all types of healthcare innovation. A really good example there is 3D printing. 3D printing is, you know, besides being a pretty cool technology, right, where you can just create new things, it's actually become a critical component for pre-surgical planning, for example, where we turn scans, MRIs, and CAT scans into a physical model. And a surgeon can actually go in and understand what that specific part of the body is within that particular veteran and better plan their surgery. They can explain the surgery to the veteran. And that technology has really emerged over the past few years. And as it's emerged, then we partner with the healthcare innovators to really help build that into the planning over the long term. In a similar way, there's a chief technology office in the Office of Information Technology. We partner with them and really try to identify pilot projects that are being successful, and as they are ready to scale to the enterprise, really help step in and insert that into the planning cycles, ensure that, you know, the requirements are well defined. And at least one of the perspectives we bring is, because we take that enterprise view, we can understand what some dependencies that maybe an innovator hadn't thought about, and help them navigate through that.
It's really interesting when you think about that kind of process. You know, it's not just the tech innovators are important. They're the ones thinking up all this, but you kind of come in to swoop in and like actually make it happen and implement the tech from a business angle. So it's very interesting. How have you seen things change over your tenure there? What areas are you still working to improve?
Yeah, so one of the interesting things, I had worked within the business architecture team about 5 or 6 years before I joined. So it's a pretty neat perspective, you know, coming back to an office that had many of the same folks that I had worked with before. You know, one of the things that I was able to bring into this role currently is that my previous job just before this was with VHA's Office of Healthcare Transformation, which is really a project management office for senior VHA leadership. I was able to engage with the field and again, with our business leaders very extensively for about a 4.5-year time period, responding to the COVID pandemic, implementing new things, helping to communicate with the field. And that perspective is one I didn't have before, but two, sometimes gets a little lost within health informatics and some of the technology space. And I brought a lot of relationships. So I've been able to really help communicate the value of what SIM does to our senior VHA leaders, and get them more engaged and help them empower some of their staff so that they can be more aware of the funding cycles, so that they can present better business cases for the work that they do, and really bring that forward. So, and as part of that as well, again, we work very closely with the Office of Information Technology is really kind of bringing that same story to our folks and our partners within OIT and help them understand the role of the operations within VHA and not just how the IT is implemented in VHA.
Right. I like that. I like the story there. That's kind of a good perspective of looking at it. So you mentioned kind of your previous role. You're not new to federal service. You've been in SCS ranks for about 18 months, but you've done other work for about 12-ish years.
Yep.
You're kind of climbing up there. What advice do you have for people looking to get into government or someone to excel in their ranks and kind of taking on a similar trajectory as you have?
Yeah. Well, one of the reasons I got into government was really joining VA and its mission. And I believe that our mission is one of the best in government in that, we're here to provide healthcare to veterans, but in a way that you can't get in the private sector, the integration of it. We actually just had some great news yesterday on the reduction of our homeless veterans. We beat out a target goal, and I think it was 42,000 veterans that we helped find a home. And there's evidence-based research that shows that if you get a veteran into a home, their healthcare, that's the starting point for the improvement of their healthcare. And so integrating those services together and that drive for a mission like we have in VA is a really critical part of why I've stayed engaged in my career in the federal space right now. Sometimes you get a little frustrated with the steps you have to go through to get a job in federal government or even to get in between jobs and the time it takes. It's not easy, right? And so that having, I've got the passion for the mission of VA. There's lots of other agencies out there, and I'm sure many of them believe they're the best mission in government as well. So finding that connection to help you work through that. Within VA, we do focus on hiring veterans. I'm not a veteran. So, if you are interested in VA and not a veteran, my advice would be, find a niche skill. I came in the enterprise architecture and the business architecture discipline, which is, you don't find a lot of enterprise architects out there in relation to a lot of the other jobs. So if you have that niche skill where you can come in and get engaged with the organization, that's another good approach. And I guess, as I've moved up into the SES core here, really the being able to make decisions and guide the organization is also very satisfying. And, that's been a key part of my journey as well.
That's very incredible kind of story there, and one that resonates a lot with other VA leaders that we've spoken to. But that mission, definitely, I'm glad you brought up the homelessness accomplishment there, because a lot of the times when you read news like that, many don't think about like the behind the scenes work that you're kind of working on. But from this industry angle, it's important to kind of recognize like, here's all the important work that goes in behind the scenes to make something so impactful like that happen. So I'm really glad I got to talk to you about that and kind of get another look into that process.
Okay. Thanks.
Well, Ian, thank you so much. This was a great conversation. Like I said, a good look at behind the scenes of some of the things that are going on in tech right now, and especially in health IT. So this was a great conversation. I'm so glad to have you. And thank you so much.
You're welcome. I appreciate you having me on. And it was a great conversation. Thank you very much.
That was a terrific conversation. As you said, I'm surprised that this is Ian's first appearance on a podcast. I thought that went great. Before we wrap up the episode, Amy, are there any last thoughts or highlights that you want to leave our listeners with?
To me, it's really interesting to note like future legislation that's going to come out. And when you're thinking about it in the context of VA, how I'm going to think about that as far as Ian's office and how he's going to start thinking about like instituting new tech and some of the emerging things that are on the horizon. So I'll be keeping my eyes open for that.
Yep. And we here at GovCIO Media and Research will be following along with any updates that happen going forward. But until then, that's all for today's HealthCast. If you enjoyed the episode, please subscribe and leave a review on the podcast platform of your choice. We'll be back next week with a new interview, but until then, I'm Alexander Bolova.
I'm Amy Kluber.
Thank you for listening. Healthcast, along with GovCast and Cybercast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them on your favorite podcast platform. And if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@govcio.com.